Well, of course, in England, where the beginning of the IVF, due to Robert Edwards and Patrick Step to Purdy and others. And Allen and Desai perhaps is the second step with the introduction of the genetic approach in IVF. It's a country where, the scientist is very important. And we have seen with Jonathan talk that is very complicated to understand. Here is the folliculogenesis, but it's the same for the competence of the embryo. And of course, with dialogue with the endometrium. That means that we try to understand in technical approach what is the good oocyte, the good sperm, and of course the good embryo, sometime by PGS or other approach. My talk today will be a little beside this approach, which is really necessary, of course. But it is interesting to see that we are not speaking only to oocyte or to sperm or to endometrium, but to a person. And for that, it's important to see what is the person that we have in front of us. And that can perhaps have some influence of the aim of the study, that means the development of the embryo and the oocyte. We have done, at the beginning of the story, more quantitative approach than qualitative. That means that we try to have a lot of oocyte, too much, and it's for that perhaps we understand that it's better to come back to the quality of the eggs that we want and not the quantity to obtain the pregnancy, test tube pregnancy. So my talk will be, and you will see that there's a lot of publication recently, these last 2 years, focus on the importance of the environment can be some influence. It was, for instance, if we look at the national survey have been done in France by Sylvia Alvarez, we see that a lot of women, infertile couple, smoke, take alcohol, are stressed, they have sexual problem, and of course, when you are treated them, you have to know a little what happened with this couple. Let's see first obesity. Obesity in men have an impact, seems to have an impact on sperm parameters. You can see that the adiposity and the body mass index, especially when it's higher one, suggests that the excessive body weight affects sperm production, but it is not clear if weight loss can reverse this effect. It will be controversy. Majority of the topic of the publication show that there is a negative effect, but there is some who are a little contradictory. So let's see that obesity negatively affects male reproductive potential, and the body size by BMI and waist circumference also can be associated with sperm parameter abnormality. What is kind of abnormality that we call? It can be sperm DNA damage, and there is a study showing that sperm DNA damage was more important in the subfertile couple where men have a big BMI. The overconsumption of high-energy diets alters the functioning of the male reproductive axis and the testicular physiology. That also is a last year publication. And more interesting, must be certainly precise, the lifestyle factors can be related to sperm aneuploidy, especially when there is excess weight and coffee drinking every day. And the exposure to air pollution can also induce sperm aneuploidy. Of course, all this work has recently published and have to be controlled, and others must be done. But it gives an alert and perhaps give the possibility to interfere, to try to to say to the men, because we are speaking on the men, but it will be the same for the women, that we can have perhaps a recommendation to lose weight prior to art. We are not sure if it's really absolutely necessary, but why not to do that? Because they will feel better, and perhaps it will be helpful for the results. So there is some contradictory data showing that there is not influence, that is also publication. It's a retrospective study, have been recently published, and type of underwear, smoking or alcohol consumption, or having a history of mumps doesn't play a role in sperm morphology. Of course, we have to distinguish sperm morphology and the fecundability and the quality development competence of the embryo. Let's see what happened in the literature for obese women. Well, in fact, it's not women, but it's animals that our team have done a lot of work on that with the INRA Institute, showing that if you give a dietary lipid and cholesterol, you can have an abnormal response to stimulation in rabbits. Of course, it's rabbits. But influence of dietary regimen and the consequence of ovarian reserve can be shown if you look at the ovulation status when there is a high caloric diet and a controlled normal diet. What's about the smoking and fertility? There is also something showing that it can influence the folliculogenesis and perhaps the disovulation also. But of course, we have to be careful because cigarette smoke contains many oxidants that can alter, but it's difficult to show active and passive smoker if it is the same. It seems, but it's a very old data, so perhaps we have to do it again. But the level of cotinine in follicular fluid have been shown also to have a lower with quality embryo results. So smoking and ovarian deficiency seems to be related, even if it's always difficult to show that it's only one factor. But I think that at this moment of the data, of the literature, we have to take in account into counseling the woman, the men, to stop smoking when they are coming to art procedure, because it can perhaps advance menopause, it can decrease the ovarian reserve, and it can be dangerous for the fertility. There is a publication, many publications, as you can see at the bottom, of the thickness of the zona pellucida and short meiotic spindle in women comparing, but in a woman, but of course it's difficult because you know the age is not the same, the story is not the same, but I mean we must take in account that it's possibly a relation between this approach. In the male factor, it will be quite the same. There is a publication showing that you will have, if you compare smoking and non-smoking, you will have better results in smoking, but of course depending also on other factors like age of the woman and everything. The effect of the in utero, it's important for the in animals. We have seen also that nicotine is playing a very bad role. And so the impact of cigarette smoking on its tone to protamine ratio in human spermatozoa and its relation to sperm parameter have been recently focused. So it's a negative relation between smoking and male factors. Alcohol, of course, it depends on what quantity of alcohol you will drink. Moderate alcohol intake is not adversely associated with semen quality in healthy men, but it can be associated with higher testosterone level. that recently also. Chronic consumption of alcohol impairs testicular function, especially if there is a presence of a gene which can give a susceptibility to develop abnormality in spermatogenesis. A study in Danish study showing in 1,221 men that there is a reduced semen quality, and of course we speak about a worse reproductive effect, but it's not absolutely clear what kind of worse reproductive effect. What about the toxic? Toxic and endocrine disruptor and a mixture of them can interfere with the organism and, of course, with his progeny. So the study in animals are now very important about what there is in the smoke of the cigarettes, and there is also a discussion about the possibility of action in animals, for example, autophagia, or a decrease of mitochondrial reparation and increase of free radical leave. So this endocrine disruptor and the action of the ovarian reserve can be also something that we have to look after, and perhaps it can interfere. The bisphenol, as you know, it's a big discussion now, because Europeans say that perhaps it's not deleterious, but there is some particularly French study showing that it is very complicated, the phthalate that we can find in different parts of our environment can be also something very deleterious. Well, we'll find, a different type of organisms that, not organisms, but molecules like cadmium, phthalate, we can interfere. There is a lot of publication of that now. What can we do? Perhaps to have in consultation a list when it will be very well done, to find if this couple are in front of environmental deleterious effects. But human exposition to endocrine perturbation is certain because there is a decrease of the sperm parameters in the literature, since 20 years, not exactly fertile consequence, but decrease of the number, even if we change the technique of numerating the sperm. And there is so different toxic or environmental factors which can be harmful for the couple infertility. So what we have to do, it's a big, even if we don't know, is to find what is those factors and to try to avoid them. And there is, of course, the oxidative stress that will be shown that can, what is the causes, the reason of this oxidative stress can have a very deleterious effect. And I see that everybody during this, we stop during the session, take his mobile phone. You must remember that if you have a project of increasing your family, be careful with that. There is no data in female, so only female can phone. But men, it can be something in decreasing motility of sperm and perhaps increasing the fragmentation of DNA. The stress and fertility, very difficult to measure, of course, the stress, but there is some experience, for example, in Japan, where during the earthquake, they compare the analysis of the sperm analysis after the earthquake and before on the same patient, and they see that there is a difference. So there is other publication showing that perhaps there is an effect of psychological stress on fertile hormones and seminal quality. In the woman, of course, is the same, and there is more studies around high stress, middle stress, low stress in women. And recently, it has been more objective because the difficulty is to find the measure of the stress, of course, by salivary alpha amylase are associated with a longer time to pregnancy and increased risk of infertility. And the author says that alpha amylase is a relation with the stress. So, how to be relaxed in this condition of the environment is so heavy and difficult to take in account. I think that it's really time, and it's in the following idea of the ISMA project to go to more natural and more soft, use of the drugs. But it's necessary also to integrate the reproductive medicine with, of course, a very strong and very precise advanced technology approach, and make, for the scientific research, but also in the practice with a complementary medical therapy dedicated to the wellness and the safe preparation of the body and the mind of our patients. And Professor Morimoto in Japan have done a lot of things according to this aim, and I think it's interesting. Perhaps you will not change for 50% your results, but I think that everybody will feel better first, and possibly it will interfere with the results. So what does it mean? It means using exercise therapy to relax the body and enhance the physical condition, perhaps improving the blood circulation of the pelvis to make the body more receptive to implantation. And if you ask to the patient, what are you doing beside you are coming to the clinic? And if you really are in confidence with them, you will see that majority of them are doing something non-really medical, non-classical medical. They do acupuncture, they do sophrology, they do hypnosis, they do many things to be relaxed, to be prepared. But it's not a control proposition. And perhaps, I think that even scientist doctor must be inside this protocol proposed to this couple to have a complete approach to them. And certainly we have to see that for some of these patients, it can be interesting to have a good balance of energy and reduce uterine contraction. So, in conclusion of my talk, I will say that, of course, we need the best scientific level. It's not a question to make an opposition between the two approaches. It's just to try to make both together, because reproductive medicine and biology is something very special, and we know that, and we will see that different glands are working together, and the brain, of course, is something important too. Understand the lifestyle, know what is the occupation, what is the lifestyle, the way of physical smoking and all this thing, the past history of each patient, not doing a systematic approach of protocol, but personalized protocol taking in account which is in front of you. Avoid aggressive and non-personalized treatment, but taking in account the personality. Increase the mild stimulation program, and especially with the antagonist use. And I take this opportunity to say that the first who had developed the use of antagonists in IVF, it's 20 years ago. It's Philippe Bouchard and I, but we use nail glue as demonstrating in a publication in the American Fertility Society that it can help to block the LH at this moment, but it was not commercialized. And after that, of course, we participate with others to the development of antagonists. And to develop cocooning approach of both partners, even the men, it's important to have something most complete in our way. Because psychological therapy, it's important to alienate the stress and perhaps to have a consequence on quality of gamete and dietary pattern and lifestyle in order to maintain the ideal weight and perhaps to have the good possibility of calm pregnancy. Thank you very much.